Hello, everyone. Welcome to the 53rd International Conference on Women, Health, and Nursing. My name is Kanjud Kabir, and today I am very glad to be presenting our research paper on the evaluation of the effectiveness of probiotics in the treatment of urinary tract infection among women in Bangladesh. Here is a brief overview of the study. Starting with the background of the study, um, let's start with a little bit about the prevalence and impact of UTI on women, especially women in developing countries like Bangladesh. UTI is one of the most common types of bacterial infections seen by healthcare professionals. It occurs in all populations and ages, from neonates to geriatric patients. But UTIs are more common in women than in men and continue to be a significant health concern for them. For example, when it comes to the frequency of UTI in women versus men, the ratio is 8 is to 1. And then its occurrence is approximately 50 to 60% of women will experience UTI at least once in their lifetime. Moving on to the cost of treatment, the annual cost of UTI treatment exceeds $6 billion worldwide. And in developing countries like Bangladesh, UTI has become a major cause of morbidity. E. coli seems to be responsible for UTI in most cases, but there are other significant pathogens such as Proteus mirabilis, Staphylococcus saprophyticus, epidermidis, and Klebsiella pneumonia can also cause UTI. On the other hand, bacteria, microbial species such as lactobacillus species can inhibit in the vaginal tract, plays an important role in the prevention of infection. There seems to be a well established link between abnormal vaginal microbial flora and an increased risk of UTI. The microbial species in the vaginal tract are crucial for maintaining health and preventing infections. A bit more on the background. So far, antibiotic treatment is the core treatment strategy for UTI, and the irrational use of antibiotics can lead to altered antibiotic susceptibility patterns and pathogens. In Bangladesh, for example, there is already an increased resistance to available antibiotic treatments for UTI. Moreover, overuse of broad spectrum antibiotics not only kills pathogenic bacteria, but also disrupts beneficial bacteria. Due to rising antibiotic costs, the emergence of multi drug resistant bacteria, and inadequate treatment options, alternative strategies, alternative therapies have become very crucial. This is where we come to the field of probiotics. The field of probiotic research is still evolving, with studies that have so far involved small sample sizes, and studies have utilized varying strains of probiotics, and they've yielded mixed results. With this background, we come to this study as we search for alternative treatment options for UTI. We are presenting probiotics as an alternative therapeutic option that aims to prevent the development of antibiotic resistant bacterial strains and restore a balanced microbial flora and enhance the body's defense mechanisms as well. This study is crucial because so far no studies have yet explored the use of probiotics for treating UTIs in Bangladesh. Coming to the hypotheses of our study, we have established that UTI occurs due to a disruption of the natural microflora. There are data to suggest that lactobacillus depletion occurs in UTI. Therefore, our hypothesis of the study has been that its restoration or the restoration of other beneficial bacteria through vaginal or oral administration of probiotics may cause recolonization of the lactobacillus in the vagina and other female urogenital organs. This restoration could then potentially help in managing or preventing UTIs. We have two aims of this study. The first objective is to evaluate the effectiveness of probiotic therapy in treating UTIs in women. The second objective is to fill the gap in research that currently exists and potentially improve UTI management strategies in Bangladesh. Moving on to the methods used for the study. Uh, this was an interventional prospective non randomized trial. We had, in the beginning, we had 162 women suffering from UTI, and these patients were admitted to the Department of Pharmacology and the Department of Gynecology and Obstetrics in Uttarakhand Medical College Hospital. The duration of the study, it began in January 2019 and concluded in June of 2021. All enrolled participants were divided into three different groups, with the first group receiving probiotic treatment, the second one receiving antibiotics, and the third group receiving a combination of probiotic and antibiotic treatment. From these patients, midstream urine samples was collected using standard techniques to avoid possible contamination, and these samples were then sent to a medical laboratory to conduct routine urine examination and culture and sensitivity test for pathogenic bacteria. The initial test of the urine samples was done before receiving the above treatment options. Then the patients who were resistant to all major antibiotics according to their culture and sensitivity tests received probiotic therapy. The dose and regimen of the probiotics consisted of two capsules, each containing Lactobacillus acidophilus, Lactobacillus bulgaricus, Bifidobacterium bifitum, and fructooligosaccharides. The capsules were administered 3 times daily orally until recovery or for 14 days. These patients then came for a follow up visit on day 30 when further urine examination was carried out. Our inclusion and exclusion criteria were the following. And the clinical outcomes that we tried to measure with our study included the cure rates of UTI, which was also measured by looking into the symptom relief of the patients after receiving the treatment. Additionally, we also tried to identify the UTI causing organisms and tried to evaluate the antibiotic resistance by analyzing percentage of resistant E. coli isolates in the urine of the symptomatic patients. So, a brief about the results that we received. Although we initially started with 162 participants, on day 30, on the follow up day, 132 patients followed up. Hence, this is our final participant group. So, out of this, 42 participants received the probiotic treatment, 48 received antibiotics, and 42 received the combination therapy. Our findings showed that there was no growth of pathogenic organisms among 99.24% of the patients after follow-up, whereas 97.62% of the subjects that were treated with probiotics showed no pathogenic bacteria growth. Coming to the laboratory findings of the collected urine samples, uh, the tables show the laboratory findings of the urine samples of the patients during enrollment as well as after enrollment. And there is also a table showing the antibiotics that were being used in the treatment of UTI. Nitrofurantoin, there are 8 different antibiotics that seem to be most commonly prescribed to patients being treated with UTI, with nitrofurantoin being the most common, and followed by cefixime uh, as another common treatment strategy for UTI management. During enrollment, we can see that the 71 patients lab investigation of the urine RME showed urinary pus cell count greater than 4. This higher pus cell count is considered to be an indication of bacterial infection, in particular UTI. So during follow up, the pus cell count in the total population of the patients decreased to 17 patients. For the group receiving probiotic treatment during enrollment, this group's urine examination showed a pus cell count greater than 4 for 17 patients, which on follow up went down to 2. The greatest percentage decrease in pus cell count can be seen in the group receiving the combination treatment, where 24 patients initially had a pus cell count greater than 4, and after the follow up examination, this patient count decreased to 6. Most of the urine samples after follow-up did not show growth of pathogenic organisms. And initially, in the lab investigation carried out in the patients during enrollment, there seemed to be a couple of pathogenic bacteria in the urine samples, such as chlamydia, mycoplasma, neisseria, gonorrhea, klebsiella, etc. But then the lab examination after during the follow-up showed only E. coli. So E. coli seems to be the most resistant species in UTI patients. So, coming to the conclusion of our study, our lab investigations have concluded that the most common resistant pathogenic organism in UTI is E. coli, followed by chlamydia, mycoplasma, and gonorrhea, uh, klebsiella. The study also predominantly isolated gram negative pathogens over gram positive pathogens. We have concluded that the use of probiotics in our study proves to be clinically effective, and our laboratory investigations also show that the eradication of pathogenic bacteria does occur with probiotic treatment. But we are concluding from our study that probiotics alone are not expected to completely eradicate infections, but can inhibit the growth of pathogenic bacteria, significantly relieve symptoms, and help cure UTIs. So, if anyone is interested to look into the references being used for the study, please feel free to scan the QR code here. And that is sort of the end of the presentation. Thank you so much for listening. And if you have any questions or queries, please feel free to send them my way. Have a good day, everyone.